cases keep rising here in Oklahoma because of the Omicron variant and the Delta. The hospitals are really concerned about capacity. 2 News Oklahoma's Amanda Slee spoke with OSU Medical Center.
The chief of staff at OSU Medical Center tells me they are feeling a strain about the same, if not worse, than previous COVID surges.
It might feel like everything's kind of gone back to normal and this is our new normal, but it doesn't feel normal here at OSU Medical Center.
OSU Medical Center is reporting that they are at full capacity with 30 COVID patients. This is leading to issues in the emergency room.
We're on ER holds. That means people that are waiting for a room and can't get one. And it can go over one shift into a second shift, multiple hours of waiting, and it's not typical for our hospital to have that. Usually we have really good throughput.
The difference in this surge compared to previous ones is more staff members are leaving their jobs.
Our regular staff can have to get anywhere from 55 to 60 additional shifts.
Besides the staffing shortage, the hospital also doesn't have enough testing supplies, with only a 2 to 3 day supply.
We don't even have enough tests to test is universally like we would have done previously. We're having to save it to only test the ones that the physicians order a test on.
While people are tired of hearing about the pandemic, Dr. Thurman says it's not over yet.
We have to just kind of refocus our efforts for the good of all of us and support our healthcare out there.
He says you can support healthcare workers by following the preventative measures, getting the vaccine and booster shots. We checked with other hospitals in Tulsa. Hillcrest says they have seen an increase in COVID hospitalizations, but it's not the majority of what they're seeing. They say their capacity issues are a mix of COVID and other conditions. St. Francis tells us that very little has changed from their update last week when they started to use hallways for patients. And Ascension St. John was unable to comment. In Tulsa, Amanda Slee, 2 News Oklahoma.